Today, let's talk about the frustration of slow or no weight loss while on a weight loss program. Did you ever ask yourself, why am I gaining weight? And why is it so hard to lose it? This one thing can make you not drop any weight. So listen up, if you're putting on weight easily and having a hard time taking it off, you should know that hormonal imbalances affect both weight loss and weight gain. These imbalances could be part of the problem or the whole problem in itself. In fact, some hormonal imbalances can make it downright improbable to lose weight. Plenty of people attempt various weight loss diets and exercise programs with the intention of dropping excess weight. And it can be very frustrating when they don't see the results. And then it can make them quit altogether and you just kind of give up. What you may not realize is that many underlying health issues can impede weight loss attempts. These same issues can be the cause of the weight gain in the first place. In addition to poor diet, lack of exercise, these things can make it worse. I frequently get phone calls from prospective patients and clients who are desperate for help because the pounds keep packing on no matter what they do. Hormone imbalances and other deficiencies can likely be the reason. Unfortunately, many of them have sought help from their doctor or other professionals only to be told that they just need to, eat less, exercise more, period. It's not only leading to feelings of guilt and shame, but also powerlessness, and this can be quite demoralizing. Some common hormonal imbalances that can affect weight loss. There are many, but the big ones are estrogen, insulin, thyroid, cortisol, and testosterone. So let's discuss hormone issues. Estrogen. Estrogen imbalance can occur at any age. If the ratio of estrogen to progesterone is off, and you can get what's called estrogen dominance, really more or less progesterone deficiency, but we'll call it that. It's also possible to have deficient estrogen levels and still have estrogen dominance if progesterone levels are very low. This is very common, especially as women enter their 40s and beyond and begin their transition to menopause or perimenopause and then menopause. Progesterone drops, and estrogen drops, but progesterone drops further. Progesterone is usually the first hormone again to drop, which creates an imbalance again between the two hormones. So again, with this estrogen dominance common, and you usually get a lot of weight gain, especially down low in the hips and the lower butt area, sometimes in the abdomen. And belly fat, lower body fat causes insulin levels to rise and can be a cause of insulin resistance. And as we reach the menopausal years and ovarian production of estrogen declines, the body looks for other sources of estrogen. And one storage source for estrogen is in the fat cells. Bodies react to this by converting more of the calories that we eat into fat to have more estrogen to draw upon. Declining estrogen levels, just like testosterone, also cause muscle mass to decline, resulting in more body fat. You need estrogen for body fat optimization and healthy muscles. Insulin. The hormone insulin, of course, is made by the pancreas and it's activated whenever we eat. Its main job is to act as a key to unlock the cells so that glucose or blood sugar can enter and then give us the energy from our food. So insulin also regulates blood sugar levels. However, the cells themselves can also become resistant to insulin, and they can't use it like they should. And this can cause blood sugar levels to stay high and much higher than they need to be in the blood. And this in turn affects metabolism and many other hormones because it inhibits the body's ability to metabolize fat. Higher insulin levels signal the body to store more fat, especially around the abdominal area. And this is the dangerous visceral fat that I talk about all the time, how bad it is. This visceral fat is hazardous to your health and can cause fatty liver disease, increased inflammation levels, cardiovascular disease, and much, much more. And this can lead to, like I said, cancer, diabetes, worsening obesity, metabolic syndrome, and many other adverse conditions. Belly fat also releases more triglycerides into the system, so it becomes kind of a double whammy hit. The two biggest causes of insulin resistance are eating a diet high in processed foods and sugars and not getting enough exercise. There's many other reasons too, but these are the big ones. The easiest way to reverse insulin resistance is to exercise and change your diet. Not only does exercise help you burn calories so you can lose weight, but it also causes muscles to become more insulin sensitive and open the doors on the cells to receive glucose and work properly. As your hormone optimization physician, I always check insulin levels as part of our routine lab work. We understand that the role of insulin resistance can have on both men and women and their health and weight. Thyroid. Currently, 1 in 5 women and 1 in 10 men in the United States has an underactive thyroid gland. This is called hypothyroidism. Symptoms can include weight gain, fatigue, hair loss, depression, anxiety, high blood pressure, cholesterol issues, and much, much more. What's particularly concerning is that over half of the hypothyroid population remains undiagnosed. Often folks are eating right, exercising, doing all the right things for their health. However, if the thyroid is low functioning or just not working properly, it can cause the entire metabolism to be slow. And this can create weight gain, make it very likely, and often in short periods of time too. Hypothyroidism also makes it much harder to lose weight, even with proper diet and exercise. We provide comprehensive thyroid testing. I always run a full thyroid lab panel to determine exactly where the problem originates. So so that it can be treated correctly. This is just not a one-trick thing in one lab test. Once the root cause of the problem is identified and treatment protocols begin, patients begin to feel better, usually within a few weeks, and their metabolism starts to function as it should again. Cortisol. So cortisol, as you know, is produced by the adrenal glands, and it's often referred to as the stress hormone or the fight or flight hormone. Obviously, our ancestors needed this to survive, right? When that fight or flight mechanism kicks in, basically blood flow to the digestive system slows down, and your body starts storing fat. The problem is that in the modern world, our brains have that same stress response. When we worry or fear that something will happen, we have other stressors, right? Emotional and other. The adrenal glands don't have any way of differentiating between being chased by a lion or having a stressful job and problems with your marriage. They perceive both as danger, which can keep the body in an almost constant state of that fight or flight. This is normal in a short run for acute fluctuations, but if it goes on for long periods of time, prolonged stress and high levels of cortisol, if they become chronic, can cause high blood pressure, elevated blood sugar levels, increased belly fat, dangerous visceral fat, and even muscle loss. If we don't know how to manage our stress levels, the adrenal glands produce less and less cortisol over time to compensate. And this can lead to another condition, what's commonly called is adrenal fatigue, which causes a sluggish metabolism. Not really fatigue, but it's a good way to refer to it. This affects not only the entire endocrine system, but also makes it harder to cope with everyday life events and makes us much less resilient and more prone to disease. Testosterone. We often hear and associate the testosterone hormone with men, but women need testosterone as well, just in smaller quantities. A lot of things can cause low testosterone, such as obesity and alcoholism, nutrient deficiencies, and more, but the most common cause is this age. Levels begin to wane for both men and women in their late 20s and 30s, even sometimes by the time we're in our 50s, levels are about half of what they once were at their peak. It's been said that testosterone gives us that pep in our step, right? It helps to keep us vital. Another big role of testosterone is to help activate insulin. So low testosterone levels can contribute to insulin resistance issues. And as we've already discussed, insulin resistance causes increased belly fat and dangerous visceral fat. Choosing a hormone optimization physician. As your hormone optimization and health and performance physician, I understand how hormonal imbalances affect weight loss and overall health in general. I use a science-based, hybrid, and holistic approach to your health that treat you as an individual so you can look and feel your best. If you're struggling with hormonal or weight gain issues, we can give you the answers and offer solutions so you can restore your health and live a life of vitality again. My consultation with you lasts almost an hour or more, so I can provide you with high-level support, guidance, and the tools you need to succeed. So we offer nationwide virtual appointments and local Central Ohio office appointments as well, whichever you prefer. Should you choose to have a telemedicine appointment, you will still be able to see me as your physician provider. Just as if you're staying in front of you in the office. Very simple. So we'll still get that same connection. We'll be able to spend the quality time with you and answer all of your questions and get you exactly what you need. And additionally, we have mobile lab services available if you don't want to go to a public lab. So if you are interested in balancing your hormones for optimal health, feel free to give us a call to find out how we can help you. Contact me at 740-777-9717 or email me at eric@drericprimex.com or eric@drericfate.com. And we can explain our protocols and fees in more detail, like answer any questions and concerns you have, and explain how the Primex approach can help with hormonal balance, anti-aging, and disease prevention so that you can enjoy a life of vitality and optimal health. And be sure to visit my website, drericprimex.com, for more information on all the hormone optimization programs that we offer. My team can get you booked for your first appointment right off the website. So until next time, stay prime.